Hi, everyone. Thanks so much. My name is Kelly Parsons, and myself, along with Julia Johnson, are the two family care coordinators at Sanders Brown Center on Aging. Harden's going to talk about what we do in a little bit. I've been in the aging field for about 15 years in different aspects. This is a talk about aging parents. I'm going to refer to parents in this conversation, but I really just want to say it's an all-encompassing term. It could be your parents, your spouse, your neighbor, your partner, your in-laws, just anybody that's aging. I'm going to frame the broader lens about what to be thinking about when you have care conversations with your loved ones. We'll look at document preparedness, move through local and national resources. We're going to talk a little bit about technology and how that can help, ways to stay active and involved for your parents, touch a little bit on transportation, discuss care costs and long-term care policies. Finally, we'll end with some definitions on community-based care and talk a little bit about Medicare and Medicare replacement policy benefits. All right, so let's get started. So as we move through this discussion, I think it's really important to understand that while we always have the best intentions for our parents, we're often so busy checking off the list of what needs to be done, we don't really stop and think about how incredibly difficult it can be to move through the aging process. So our later stage in life is where we experience the most loss. Loss needs to be acknowledged, grieved, and it's really important to understand when depression sets in. Depression is often unrecognized in older people, and often the cause of it is some type of loss. So these are just some things that older people can lose. The ability to drive, living arrangements. You think about, we have participants, they moved from North Carolina to Kentucky to be with their daughter. In North Carolina, they had a bridge group that they played bridge with twice a week. They had a religious affiliation that they were very involved with. They had an interlocking community that connected them. And when they moved to Kentucky, they lost all of that. Memory, certainly, cognitive impairment, sensory, so thinking about hearing loss, vision loss, you actually kind of lose some sense of touch as you age as well. And then loved ones and spouses also. Okay, so let's talk about documents and conversations to have. First and foremost is the 5 wishes. This is actually University of Kentucky Hospital Advanced Directive. I say Advanced Directive, you might have heard it as a living will, you might have heard it as a healthcare power of attorney. It's all the same thing, and really what it is if your loved one was not able to speak for themselves, what they would want medically to be done to them. This is something that not a lot of people have, but is incredibly important, especially if you're trying to assist them in meeting their needs and their wishes. So this is the 5 wishes. If you're not ready to quite delve into, do I want to be resuscitated? Do I want a feeding tube? Do I want those kind of things? There's a kit called the Conversation Starter Kit that can kind of help wrap around what are some of the questions you want to ask your doctor, what are some of the questions you want to ask your loved one and your parent, what they would want, even what you would want. Everybody needs this. And it's the Conversation Project. I don't have these on the table, but certainly my card's on the table. So you can shoot me an email and I can mail one out to you, no problem. So durable power of attorney. Please check with your parents to see if their power of attorney has the word durable somewhere in it. Because a general power of attorney, if they have a stroke or get in a car wreck, becomes null and void. A general power of attorney is only used if the person has cognitive capacity to make decisions for themselves. A durable power of attorney, however, it's durable, so it'll be with the person that can make decisions for themselves and a person that can't make decisions for themselves. That means if you have a durable power of attorney, your loved one has a stroke, you need to pay the electric bill and the mortgage, you can walk into that bank and sign that check as your loved one. If it doesn't say durable in it, you're not allowed to do that. And then that's a whole nother process of guardianship that is a huge stressor to walk through. Deeds, elder lawyers will help figure out if you want to get your name on the deed to avoid probate. Passwords, The will location, I tell this story often. We had a participant whose husband died. It took her 3 days to find the will. Insurance cards, life insurance information. And then this last one, I've started to notice more and more. If you go to the doctor with your parent or loved one, ask for a release of information. And that way, when you call them and say, I think the medication is up, or, when is this supposed to be renewed? They won't say, I'm sorry, it's against HIPAA policy. I can't talk to you. You can say, actually, there's a release of information in the chart if you want to check that and give me a call back. It just speeds up the process to make sure you get the information that you need in a timely manner to help provide care. Okay. So Area on Aging. I love the Area on Aging. I actually used to work for the Bluegrass Area on Aging. They're fantastic. So the Area on Aging Agencies was established within the 1973 amendment of the 1965 Older Americans Act. It requires each county in the nation to have an Area on Aging. Certainly the local agency can service surrounding counties. However, they will have information on services available in each of the counties that's in their designated region. If you are providing care to a parent locally or by distance, get connected with the Area on Aging in their county. So I'm not sure who's beaming in from the internet, magical place, but these are some of the places that might be with us today online. A few of the programs to highlight for Area on Aging, they have the Aging and Disability Resource Network. This is the ADRC, and it's really your first stop to find out information and assistance for older adults. People with disabilities, caregivers can call and get information, professionals can call and get information, and it's really kind of a connecting site. They also have Area on Aging has the National Family Caregiver Support Program. Make sure the online people get us. So the National Family Caregiver Support Program is an awesome resource. You get $300 a year from the federal government if you provide care for a loved one 60 or older. If they have a diagnosis of dementia, they can be 55. This is not asset-based. You just have to fill out paperwork saying you provide care and you are provided the money. I will say some Area on Aging run out of money. I know the Bluegrass Area on Aging, every July is when this is up for renewal because it is you have to do it yearly in order to get the benefits. They also have home care programs. Now this is state specific, so each state will differ depending on how much money they decide to put in the program. But home care programs are for individuals who have low income and are 60 years or older. They need assistance with 2 activities of daily living. Activities of daily living such as meal preparation, laundry, housekeeping, grocery shopping, things like that. So Area on Aging, can't say enough great things about it. It's a phenomenal resource for everyone nationally. Okay, so excuse me, let's talk about community supports that might be available to help your parent or loved one. So the first one, the occupational home safety evaluation. So home safety evaluation can be done through home health care. This is a Medicare benefit. It would require a written order from a medical provider like a physician's assistant or a physician. They also can provide medication management and education. If your loved one has had falls, they can do what's called a gait assessment. Gait means kind of the way that you walk, if you're safe or not. And so the home safety evaluation really can look at where you need a grab bar, maybe where rugs need to be pulled up, maybe where lighting needs to be. So many people fall at home because they can't see where they're going. And so getting an occupational therapist in the home can really help reduce fall risk. So medication therapy management program. This is through Medicare Drug Plan Part D. So if you have Part D, this is a free service offered to you. This is where a pharmacist and you sit down and review all of your medications. This is a really great program because, I might see a cardiologist at UK, but my primary care is at Baptist. They're not talking to each other. So the pharmacist is really the only person that knows all of the medications I'm on, if there's any drug interactions with them, or maybe if I just don't need it anymore. Even if you don't have Medicare Part D, I always suggest you get a list of medications from your pharmacist to know exactly what's being prescribed and by who. So the Commodity Supplemental Food Program, this is not available. It's a national program, but it's not available in Alabama, North Carolina, or South Carolina. Just want to highlight that. But this is a food program for low-income seniors offered through the Department of Agriculture. My first practicum at the Lexington Senior Center, I delivered commodities to seniors that were homebound. It's a great program. It's fresh vegetables. It's a lot of good stuff. And again, if they're homebound, typically this is through local senior centers, and they will deliver at no fee. So geriatric care managers, you see these more and more. They are private pay. Insurance does not pay for them. But a geriatric care manager can attend doctor's appointments with your loved one, supervise medication, assist with billing and claims information. Just take out some of those pieces that you might have. When we provide care for our loved one, it's such a gradual process. We don't realize we're underwater until something major like a crisis event occurs. So any piece that you can get taken away is really important. So if somebody comes to you and says, how can I help? Instead of saying, I don't need any help, thank you so much for asking, we're doing well, say, can you bring dinner over on Wednesday? That would be great. Can you pick up this medication at CVS? It just got filled. You know, there are little things that, can you take my mom out to get some new summertime shirts? There are little things that can be done that will help take those pieces off and lessen some of the stress that you have. So adult day health programs, also I'm a huge proponent of. They're fantastic. So unfortunately, some adult day health programs take Medicaid. Most of them are private pay, specifically for like cognitive impairment. But it's a very social program. They're able to provide meds. There's a Best Friends adult day health program here in Lexington, which is in an assisted living facility. So women can go get their hair done if they'd like. It's so fantastic because you want your loved one to stay social and stay active. And adult day health programs help that, but keep them at home. Okay, so let me get a drink and then we'll talk about using technology. And while I'm drinking, can anybody tell me what that round circle thing might be? Anybody take a guess? No, it's a medication dispenser. So, excuse me, the interesting thing about this medication dispenser is it only will dispense the pills at the allotted time. And it'll beep again. And if they don't take the medication, it's going to send you a text message that your loved one didn't get the medication. So you can call them and say, hey, it's time for your medication. So that way you know that they're taking their medication on a regular basis, which we all know is so important. So some other things that can be used in regards to keeping a loved one safe. The Echo, I always want to call it Alexa, but that's not it. The Alexa can tell you the date and time, can make to-do lists, can give you reminders, so medication reminders, reminder to walk the dog, reminder to feed the cat. They also have a Find My Phone app that's free. And if you say Find My Phone, it'll send you an alarm to your text message. So even if your phone is turned off, it'll still start beeping, which is pretty amazing. They also have an Ask My Buddy. This is also a free add-on to the Echo. And you program your number in and they just have to say, Alexa, call my buddy. And you'll be called immediately. Now, this isn't a replacement for 911. But it is definitely a good thing. And then in the intercom system, another thing that the Echo has is called Project Nursery. It's a monitoring device. So a camera is set up to it and it has Wi-Fi, so you can check on your loved one at home. Now Ring, this at the bottom, does the same thing, but it's probably going to be a lot more expensive. But you can get multiple cameras for Ring. You can also get multiple cameras for the Echo. So maybe the kitchen in the living room or the front door. And then this one, the I've fallen and I can't get up, has certainly come a long way. It's not just a lanyard with a push button, even though they still do have those. This one can be worn, so if they take a walk, they can wear it and it will still work. There's tons of options. This one is called the Medical Alert System. For the cellular service, it's a $30 a month fee. They have a GPS tracking option. They also have fall detection for $10 a month, which isn't too bad. So lots of different technology that's available. All right, so let's talk about staying active involved, because research shows if you stay social, if you stay engaged, if you continue to learn, you're going to have a healthier brain as you age. So some of the things that are available: how do you keep your parents active? University of Kentucky has what's called the OLLI program if you're local. It's in Lexington and Moorhead, and it's a learning program for seniors that offer specific classes, so semester-like class courses. They also offer speaker series and social outings. It's a great organization. I think it's a $35 annual fee, very well connected. So other social engagement activities, the Silver Sneakers. If you have Medicare or a Medicare replacement policy, it's free of charge to you, and it pays for gym memberships nationally. There are over 16,000 gyms across the country that participate in this program, excuse me. And then senior centers. This is our beautiful senior center. It's fairly new still, has a wealth of activities. They have Tai Chi, they have pottery. They also have a daily meal for your loved one. They have transportation. I believe there's a fee, but something to tap into, even if you're not local to Lexington, is your community senior center. And then last but not least, libraries. They're not just for books. You can stay involved, learn new things, and meet new people at your local library. Lexington classes, just doing a quick search, there's a genealogy class, there's a home organization class. They have multiple phone and computer how to use classes, which is always good. So lots of stuff to do. How do we get there? There's a few transportation options. ITN America, I think locally it's called ITN Bluegrass. So Lexington has this. The other places that might have it, they're in Keenersville, North Carolina, Myrtle Beach, Birmingham, Alabama, Monterey, Portland, San Francisco. And they're popping up all over. And so what this is it's a senior transportation service. You pay a very small fee and you call them and basically schedule a ride. So it's kind of like Lyft for seniors, except it's a little more eyes on, right? They're going to make sure they get into the door. They're going to make sure they get into the car safely, that kind of stuff. And ITN will take you anywhere you want to go. So you can go to the mall, you can go to your doctor's appointment, you can go get your hair done, lots of different places. So Lextran and the Red Cross have paired up to do wheels. I'm sure we all see these. This is specific to medical appointments, but it is an option. If your loved one has Medicaid, there are transportation services available that will take you to their doctor's appointments at no charge. I think in Lexington, it's called Federated Transportation Service, which is also good. So driving evaluations. I know driving is a really big thing, right? Safety. If you're worried about your loved ones driving, typically acute rehab hospitals like Cardinal Hill here in Lexington will do a driving evaluation. So they'll take your loved one out on the road. There's also a test, a computer simulation. And at the end of it, if they pass it, they're going to get an insurance certificate absolving them of liability. So sometimes that absolve of liability helps the older person take the assessment because they don't want to be sued. So transportation. Safety and scams. Can't talk about aging parents without safety and scams. It is absolutely astonishing how many people get scammed, how many people who don't have any memory or thinking problems that get scammed. So there's a lot of different things you can do. This is for landlines, the picture in the middle. And you program the numbers that you want to come through, and those are the numbers that come through, and no other numbers come through the phone. Set account text alerts. If you have access to their bank account, if they allow that, if you see a $500 withdrawal and you know they're at home, that's a quick way to stop somebody from depleting their bank account. Scammers will call people and they're very rushed. They have to get the money now, or their loved one is going to be hurt, or they have to get the money now, or, this, that, and the other is going to happen. Scammers always want the person they're talking to move very, very quickly. They don't want them to stop and think about things, because then they'll realize they're being scammed. So talk about tactics scammers use. Scammers are in a room kind of like this with phones everywhere. And once they get a live number, that number is then sold to the other scammers around the room. So it just really never stops. It's terrible. There's some information at the table about scams, and you can get scam text alerts. So if there's a major scam coming through Kentucky, you can get a text alert about it. Talk to your loved one, talk to your parent. If you see this, if somebody calls you, don't do it. Don't give them any money. And then for cell phones, the app right here, it's $1.99 a month. I'm not going to try to pronounce it, but Wired rated it excellent to block scams. And what it does is it looks at all of the known scam numbers and won't let them come through. So if you're worried about your loved one having a credit card or a debit card, there's what's called secure credit cards. They're a little bit different than prepaid, but you put the balance on you want, so maybe $200 balance, and once that's gone, it's gone. So no scammers can get other information in regards to banking. Okay, falls prevention. Out front, we have this Creating a Safer Home sheet. If you want to pick it up, it talks a little bit more in depth about things, but lighting is a big one. Those lights that come on automatically as you're walking through the hallway are great for people, especially because older people have to go to the bathroom a lot in the middle of the night. You want to make sure the stairwells are free of clutter. Mine is not right now, I can tell you that. Firearms, if you do have firearms in the house, lock them up. Keep the ammunition separately locked up from the actual firearm. Heating pads and curling irons, things that can burn, scalding water, something you want to just think about. Maybe get a curling iron that automatically turns off after it's been on for a little while. And then medication. This handout talks a little bit more in depth about medication, but you just want to make sure that they're taking it correctly, that they're not overtaking it, different things like that. Okay. So what's the cost going to be, right? That's a big question. So this is national. It's a little less for Kentucky, but skilled nursing facilities monthly, a little over $8,000. Personal care home aid. So a personal care attendant, typically a personal care company, is not a home health company. They're different. Home health companies are paid for through Medicare. They're limited time based, 6 to 8 weeks usually. But a personal care attendant is private pay. It's not covered through insurance, but they can come and provide those activities of daily living, like bathing, toileting, housekeeping, different things like that. So that $3,200 is actually 8 hours a day, 5 days a week. So, if you only have them come 3 times a week, it's going to be less. Assisted living facilities, and I'll talk a little bit more about them, but typically anywhere from $4,000 to $6,000. And that does not include personal care facilities. I'll talk about that as well. Personal care facilities are more expensive because they provide more medical care. And then adult day health programs at about $1,500 a year. So how are you going to pay for it, right? Because insurance doesn't pay for any of this. Now, if you're in a rehab facility, they'll pay. But if they're just there because they need care, they're not. So long-term care insurance can be helpful. However, long-term insurance of days past is long gone. So these older policies that these people have that pay $194 a day for the rest of their life, you're just not going to find that anymore. Premiums have increased twofold. And they say if you buy a long-term care policy, to be prepared for the premium to increase about 40%. So if you carry the plan, you must keep paying the premiums until you need the care or you forfeit your future benefits. About a quarter of people who have signed up for long-term care at the age of 65 or over have stopped for whatever reason, maybe cognitive impairment, maybe financial, they can't make the payments financially anymore, have stopped. All of that money that they paid in before is lost if you stop paying. Read the fine print. Some policies make it very difficult to get personal care into the home. Some policies have a clause that if you're going to have personal care, it has to come through a home health agency. Home health agencies are licensed by Medicare. Personal care agencies are not. So it's very different, and you're not going to be able to, it's really hard to find one that's able to give you personal care instead of the home health nursing care. Companies are starting to have short-term care policies. These are pretty popular. So short-term care policies cover up to 360 days. So it's a short-term policy. This is really great if you need to move a loved one in a nursing home, but you need a little bit of assistance beforehand. And sometimes it'll cover personal care in the home or a facility. Again, read the fine print. So I don't know if you've heard the hybrid life and long-term care policies that are available these days. They're very, very popular. Premiums are fixed, so it's a one-time premium. Typically, it's about $89,000 that you pay one time, and you'll have this policy. Read the fine print versus how much it would pay out if you would need to use it versus how much it would pay out your family members if you died. Because if you look at the potential earnings, if you put that in a money market and invested it, you might actually get more from the money market because it's such a large premium at the jump. So just things to think about in regards to long-term care insurance. So types of community living, there's assisted living, personal care, memory care, skilled nursing facilities, and continuing care communities. So Kentucky doesn't have a lot of continuing care communities, but I know Ohio has a lot. And that's where you move in maybe as an assisted living or an independent living cottage. And as your needs progress, you move to the next one on that campus. So you're not making two major moves as your needs increase. So this is in regards to Kentucky laws. Assisted living is an environment it's a home with amenities. Assistance with household and related activities such as housekeeping and laundry can be an extra fee. They also will have scheduled social activities. Personal care facilities, there's a little more regulation to it. They have to provide basic health and health-related services. So this is continuous supervision and monitoring of residents to ensure their healthcare needs are met. They can supervise self-administration of medications, but they cannot give it. They also have typically physicians that will come out and see patients on site. They must provide social and recreational activities and stimulate physical and mental abilities to the fullest. So memory care, I will say, capitalism at its finest because they are vying for that dollar. They're going to have pools and tennis courts, and really, the food is good. I'm not going to lie. But you really need to be specific on what your loved one would want. Do they want a facility that has, 400 people in it? Do they want a smaller facility? Different things like that. But you hear a lot of memory care. We offer memory care. We offer memory care. What is memory care? Well, memory care is really just licensed as personal care in the state of Kentucky. There's no regulations or laws in regards to what they provide if they call themselves a memory care facility. It is for individuals with dementia who require a higher level of supervision. But again, they are only in the state of Kentucky licensed as personal care homes. These facilities are, so assisted living, personal care, and memory care. These three levels of care, you have to be able to feed yourself. It can be finger foods. You have to be able to ambulate, so you need to be able to either walk or roll in your wheelchair on your own, and you can only be a standby assist. So that means if you need help transferring from your chair to your bed or to the toilet, you can only have somebody kind of not even bear weight. If you increase care needs beyond that, you're going to need a skilled nursing facility. They're not going to tell you that when they give you the really nice tour. So those are different types of housing facilities. I'm going to touch on this, and if you have questions, I'm happy to answer them. But Medicare supplements, and Medicare replacement policies, these are not all the same. Medicare is your red, white, and blue card. Medicare supplements will help pay benefits. So it'll help pay a hospital deductible if you get into the hospital. If you are at a skilled nursing facility for rehab, physical therapy and occupational therapy, Medicare will pay days 1 through 20. If you have a supplement policy, at day 21 to 100, Medicare will pay 80%. Your supplemental policy will pick up that other 20%. Medicare replacement policies are HMOs. They are organized insurance organizations that decide where you go and decide how long you stay. Traditional Medicare, you get 20 days. If a physician or a medical provider says that you need that help, that's what you get. So, there's pros and cons. I know to Medicare replacement policies versus traditional Medicare. They are calling themselves Medicare Advantage now. So when you hear that Advantage word, it's a replacement policy. Couple of references. Oh, whoops. There we go. eldercare.gov. If you search anything, you're going to get a lot of like a place for home is, it's a service, but they're going to get money. Eldercare.gov is run by the government, and it's really elder care resources for anywhere in our country for any type of service that you might need for your parent or loved one. So that's all I have.